And we simply made a promise, we're going to end the waiting list. With that investment, with a whole new team of attitudinal approach to say we can do this, I'm really, really proud to sit here today and say we've kept that promise. Yeah, we're here today. This started on March of 24, and what is it, almost July 1st of 24, so that's, what is that, 16 months later. There's been extraordinary things that have taken place. So, yesterday doesn't matter. It is an embarrassment that it's gone on, but the good news is it's zero, and we've gotten it done the Nebraska way. I'm really, really, really proud of all the work that Tony and everybody here in the Department of Health and Human Services have done to roll their sleeves and say, hey, let's make this happen. So today, when a baby is born, they're going to get services immediately. There's no waiting. There's the word registry. Let's get that off of our list. Let's not use the word registry. So everybody's services are acquired when they're needed, and so it's really, really about changing lives and impacting families. We've rolled out a new way of providing the services, which is participant driven. It's built around what each person needs, not instead of a great big whole blanket of things. And so, as I love to say, from the river to Harrisburg, we're making sure every Nebraskan has access to care that grows with them, tailored specifically to their needs, their dreams, and their future. One of the things I'm most proud of is how everybody's stepping up for kids. It is the one thing we all agree on in Nebraska, right? Our kids are our future. We never, ever, ever give up on a kid. And so when we launched the Family Support Waiver to help families care for their children, young and old, at birth to 21, it felt right at home. This program is all about empowering our families, giving them the tools to support their loved ones with helping their kids and become independent and stay connected to their communities. In addition, we're utilizing the Katie Beckett program, and since July, we've opened up Medicaid to families no matter their income. In just 15 months, this is pretty amazing, guys. We've taken 3,000 families get off the developmental disability wait list, including more than 400 families. Yeah. That's it. We should have Harry Husker here celebrating that. And then there's 400 families that are new to the list as well. So remember, new babies are being born every day, and they're not waiting. They've been taken care of. So. And I get the privilege to meet moms, come up and say, what this has done is change everything. We've sacrificed everything for our baby without the help. And so when I have that moment, I don't need much else. I don't need any breakfast, lunch, or dinner. That just has my tank jacked up, that we all together can make an incredible difference. It's about making life better for our kids and our families and all the generations coming up before. So I think that it's really a big day. It's a great day for who we are as Nebraska. We're standing up, solving problems, fixing problems, not casting blame, but let's just roll up our sleeves and solve problems. My view, it's our job. I, as your governor, can't do it alone. We together can. We've got a great team at the Department of Health and Human Services, and it's a part about to build Nebraska to the good life, right? For every single Nebraskan, no matter what gift we're given from the good Lord. So I think that it's pretty cool that we're 3,000 families down to zero, and that we've made significant investments to make this happen. It's a celebration today, but we're sure as heck not finished. This work goes on every single day, And this list will not grow. This list is sustainable. This list will be kept at zero as people graduate from it and move on and taking care of babies. So I've got to give a couple shout outs. The advocates like the ARC of Nebraska kept us honest and tell us the way it is, and let's figure out a way to keep getting better. Their passion drives us, and a shout out to all the families that are here today. Yeah, thank you for your belief and your trust and your support. And obviously to the Vital Services team, to everybody at the Department of Health and Human Services. It's a backbone of this, making this happen. So it's pretty cool. Nebraska's a leader in this. We're not taking a back seat to anybody in the United States of America, taking care of our most vulnerable citizens. I think that's a shout out. Now we've gotten rid of the registries and wait lists for action and hope, and being excited about tomorrow. We are building a stronger Nebraska every step of the way, and we're all doing that together, every single family, no matter what our circumstances are. So before I wrap up, I want to bring up someone who's at the heart of this work, Joshua Baumgartner, part of the developmental director here at Vital Services, has done a lot, and I just had an extraordinary privilege of coming through and the tour of the facility here. But as I said, more importantly, your team and all the people you serve. So Joshua, please come up. Congratulations. Thanks for hosting.
Thank you, Governor Pillen and Director Green, for joining us here today at Vital Services to celebrate the elimination of the developmental disability waitlist. Thank you for shining a spotlight on the developmental disability community and for your commitment to meet the needs of all Nebraskans with IDD and their families. We are proud to welcome you to our campus here at Vital. Vital has been a service provider since we opened our doors in 1996. Our mission and goal is to offer exemplary service, dignity, and respect to all participants that come into our services. We strive to have individuals gain independence in all their daily lives. We've grown our program throughout the years and currently are serving more than 100 individuals in numerous capacities. We have a day site where participants can come, learn new skills, and also access the Lincoln area through community integration. We provide support to individuals that have competitive employment through job coaching and vocational rehabilitation. We also serve individuals in the residential community, whether that's in group homes or themselves living in the Lincoln area. Our division of shared living providers offers individuals the opportunity to live and immerse themselves with families and immerse themselves in their day-to-day lives. For the last 15 years, I have witnessed the struggle of the waitlist that it has had on families. It has deterred much needed care for many people all over Nebraska. With this elimination, we have seen many families receive the life-changing services that have eluded them for so long. One story I would like to highlight is a man by the name of Lewis. Lewis started coming to Vital Services and was a private pay because he could not get services because of the wait list. He came on Thursdays and immersed himself in this environment, and his smile was infectious. But we were sad that he was only able to come one day a week. With the elimination of the wait list, he was able to get services and now attends full-time. Now he is able to come, utilize day supports, and access the community through community integration. This in turn has dramatically helped him with the skills and will give him a brighter future. And yes, he still does have that infectious smile. We just get to see it 5 days a week. Thanks to the new family support waiver, we've also launched the summer program that for participants that are under the ages 21 years and younger. In just a few months, we've welcomed 11 new participants into this new program with more signing up. Watching them grow, connect, and explore their community together is inspiring. we were fortunate enough to renovate a new area in this building and designate it just for them. And we are excited to see and continue expanding this program for the next year. I would like to close by expressing my deep gratitude to the entire team at Vital. I truly believe that we have the best employees in the world. When the waitlist was eliminated, our team did not hesitate. They stepped up. They worked harder, stayed longer, and went above and beyond to make sure that all the new individuals had the care and received the support they deserved. Their dedication is what made this transition possible. Lastly, thank you again, Governor Pillen, for investing in creating a brighter future for Nebraskans with IDD. Governor?
Thank you and congratulations, Josh. And it is unbelievable. I don't know how many different people I met on the team here. One said, how long you been here? 25 years. Another said 18. Another said 11. That they've answered the call and they're here doing extraordinary work every single day. Well, obviously, this wouldn't have taken place without the DHHS team, and want to really give a shout out to everybody. You all know who you are. Your fearless leader, Tony Green, said, let's go. Tony, congratulations.
Thank you, Governor. Wow, we made it. Some of you were with us what seems like maybe a lifetime ago, but it has been a whirlwind of 15 months, let me tell you. This truly is, as I've said before, when we announced the elimination of the waitlist in Omaha 15 months ago, I said that this certainly was a dream come true. And today it came true. So, the work that went into this is incredible. As you heard from the governor, we've had this list for a number of years, and it has always been kind of the thorn in your side that you knew that we were determining people eligible for services only to say, we'll call you back in about 8 years when we're ready. So today, I can proudly say I rode the elevator down. They gave me the honor of taking the final letter this morning down to the post office. It was a very somber, quiet elevator ride down with that envelope, but I can tell you that at 10 a.m. this morning, the last envelope went in the mail this morning. So. I too want to thank the governor for his support. Finding efficiencies and investing those in our vulnerable children and adults in Nebraska is what it's all about. I am proud to be on the team with Governor, who often will end his conversations with me saying a few simple words when faced with the decision. What's the right thing to do? And I can tell you this was the right thing to do. Our new way of supporting Nebraska kids and adults will no longer leave you on a list waiting for a full array of services that may or may not even be needed when that offer came. Our continuum of supports that start at birth will meet the needs of kids and families all along the way. The new approach will allow families to access our supports early and prevent costly out-of-home placements. It preserves those out-of-home placements for when they truly become necessary. We explain this as a comprehensive continuum of care that's designed really to meet kids' needs all along the way. So as you heard the governor talk about Katie Beckett, which is a Medicaid program, a lot of our families with little ones were just saying, I need help with the cost of services and care, surgeries, treatments that my private insurance isn't covering. And now we have the ability to help support families with that Katie Beckett and the Medicaid program. Over the past 15 months, the division, along with our providers, participants, and key stakeholders, have worked hard to eliminate this list. We started in March of 24 with a little over 2,700 folks on that wait list. And as you heard, new people were being added daily as they were determined eligible. Our service coordination team connected families with providers to meet their needs. As of June, we've sent out over 3,100 offers to folks across the state for various waivers and services within the department. There is still work to be done, right? We still have progress to make in the coming months. We'll continue to build our needs-based assessment, which many of you have heard referred to as the INTERI. There actually was a call today at noon as I was coming over here with our federal partners at CMS we're in the process of getting those waivers finalized and approved for a July 1 implementation. So we're excited about that, which will truly begin to kind of drive that needs-based approach for services as opposed to just arbitrarily waiting on a list for a date to all of a sudden happen. So this really is, again, a new way of how we're doing business. It's the right way to do business. It's the way that we can meet everyone's needs across Nebraska and not just a select few. I again want to thank Governor Pillen for his support and leadership. I also want to take a moment to thank a few of our teammates, our two deputy directors, Kristen Smith and Jen Clark, for their steadfast leadership in this endeavor. Our eligibility and enrollment team for expeditiously processing applications and determining eligibility for our folks, our policy team for all of the behind-the-scenes work that they do on our waivers, and of course our service coordinators across the state who spent countless hours meeting with families, assessing their needs, and assisting with getting them into service delivery. I would also be remiss if I didn't call out a special thank you to Kathy Ahrens, our program specialist. Kathy has single-handedly managed this waitlist registry for a number of years, and when I tasked her with, hey, we're going to get rid of this, there was excitement, but then it was, what does that mean, right? So we've managed this for so long, and so Kathy has been the person for the last 15 months who has mailed you your letters, taken your phone calls, set up the times for folks to come out and meet with you, and really just done a tremendous work to get us to today, where there is 0 on the wait list. We have many things for Kathy to do over there now that the wait list is gone, so plenty of work on Kathy's plate still. We also could not do this work without our provider community. Joshua, I want to thank you and all of the folks here at Vital Services for your commitment to serving folks with developmental disabilities, and also the countless other DD provider agencies across our state, some of whom are with us today in the audience. Thanks for all you do to make dreams come true for the folks we support. I truly am excited for today, honored that I can say that this was one of my professional milestones, that I swore we were going to get this done someday. Many years I thought it was never possible, but again, I can't thank the governor enough for supporting this mission and the work that we do. It's infectious. When you come to things like this, you can't help, as the governor said, it just makes you smile. And so I have one of the best jobs in the world, and I thank you for the opportunity to serve each and every day. Thank you.
I talk about it all the time to our kids, and I think it's important for every single one of us, no matter what age we are, that we have dreams, that we have hairy, audacious dreams. So, Tony, what's your next dream now? But it is important, right? If we have a dream, that helps us believe, and then that gives us a North Star to do our best every single day to make it happen. Now, I know you didn't come to listen to any of us that are here. You're here to hear from Kyra Amos, a Vital Family Support participant, and her mom, Andy. So, Kyra, it's all yours, honey.
Oh, I broke it all. Leave it to me. All right. Thank you, Governor Pillen, for your commitment to eliminating the developmental disabilities waitlist. This initiative, especially the family support waiver, is a relief for us and our family. When I think about what the elimination of the waitlist really has meant to me as a mom, the first word that does come to mind is relief. My daughter finally has the support that she needs, not just for today, but for her lifetime, support that will help her grow and thrive and stay connected to her community, advocate for her goals, live independently. With this support, I truly believe she will flourish. We haven't been receiving the family support waiver services for very long, but even in this short time, we've seen real changes. She's more confident, she's more engaged, she's doing things that excite her. As a mom, there's nothing better than knowing that she's not just safe, but she's doing something active and meaningful every day. I often think about how much easier it would have been if this kind of help would have been available when she was younger. Parenting is hard. Parenting a child with special needs is hard. And when you're not sure where to turn for help, it does feel very overwhelming. For a long time, it felt like I just had to figure it all out on my own. And as a parent, working parent, trying to juggle schedules, money, all the things, it was exhausting. So having the support has changed our daily lives. We do feel supported, and that really does make a big difference. So families no longer have to wait until their child becomes an adult to finally get that support, and that really is a game changer. Our service coordinator has been so helpful. She walked us through every single step of the way. For any parent who's unsure, nervous about the family support waiver, just do it. Just go ask the questions, sign up, learn more, and get the support. It really can help you. So again, thank you, Governor Pillen, for investing in improving the lives of individuals with developmental disabilities and their families. Okay, now you.
My name is Kara Amos. I work at Vodka Coffee Company here in Lincoln. I have many friends that I work with, and we have a good time. At Fado, I am in the summer program. I love to go out and do things with my friends. One of my favorite things to do is bowling, because I get to hang out with my friends and have Sprite. I am glad me and my friends have programs like Fado to keep us busy and connected to people.
I don't think we can say it any better. Keep us connected with our friends, keep us busy, make us feel good and feel important. Any questions from the press? Yes, sir.
So the waiver system, how easy is it to apply for it? How fast do you get approved for it? And what's the best way to do that?
Tony?
Sure. So
Yes, yes, and yes.
I would say we've done a lot of work on streamlining the process to access our waiver system. Probably the simplest way is to go online to our webpage, where we have a link in iServe, where you can apply directly online for programs. You can simultaneously apply for the waivers and Medicaid if you don't have Medicaid yet. And then from there, we kind of take it over, right? So you just really have to fill out the basic application. We have an entire team of dedicated eligibility and enrollment folks that will meet with you, walk through the process, obtain any records that might be needed, because we do have to verify some things. And then really the conversation starts from there about which waiver is most appropriate for you.
But like, how fast do you get a response back from the people at the registration office once you fill out that application?
Yeah, so it probably, the answer is depends on what comes in with the application. So one of the ways that we made our process a lot easier for families is that you can fill out the application and just sign a release of information for us to go obtain records from your school or your healthcare providers. That then takes the process a little bit longer, because obviously we're dependent then on external agencies submitting records to us to review. If you happen to have all of those records and submit those right away with your application, that process is generally in under 30 days.
Andrew?
Question probably for Tony. I think earlier this decade, estimates were that it would take more than $100 million to eliminate this wait list, and you guys described that you did it in around $40 million. I guess, how are you able to do it with that little resources? And I guess, how do we know that it won't come at the expense of services for families?
Yeah, so the question was, how are we in previous projections to eliminate the wait list under the old methodology? How are we able to eliminate the wait list now at a lower cost? And it's really simple. The old way was solely dependent on one waiver, which was called the comprehensive waiver, right? And so that waiver has the most array of services within that system. And what we were finding is that many families, when they were getting that offer, oftentimes were declining the offer because they didn't need services at that time, maybe only accessing a smaller package of services like respite or childcare, things like that. And so in previous estimations to eliminate the wait list, because we only had one way to offer services, we built the cost models at that time on giving everybody a comprehensive waiver offer, which was the most expensive waiver that we had. The new way that we proposed and launched last year really took those families that were on the list and kind of projected them to be in various buckets, right? Some people just wanted Medicaid, as I explained earlier. Some folks just want some respite. And there are some folks who will need and qualify for the more deeper end residential services. And so when we were able to split out the folks that were waiting kind of into different buckets, it allowed the money to go a lot further. And that's really how the system then becomes sustainable, is that you start delivering those services that are cheaper, less frequent, like Medicaid, like respite, early on, avoid those crises and hopefully prolong family placement for as long as you can, and then save those residential services for when they're truly needed.
If I can add, thanks for asking that, Andrew, because it is a big deal, right? Your math says we saved almost $60 million, and it's a beautiful example of our mission of improving services, saving Nebraska, and improving services for every Nebraskan in need, and saving money. And this is so family focused on the family needs, not a gigantic umbrella of things that cost lots of money that nobody utilizes. So a gigantic win-win all the way around for families and for Nebraska taxpayers. So, and again, kudos for our team developing that system to be family focused on their needs. And Andrew?
How do you assure families that it will grow, your assessment will grow and become more comprehensive if they need that?
Yeah, so the question is, how do we assure families that our assessment will grow with them? A couple answers, Andrew. I would say there are two assessments. So there's a child assessment and then there's an adult assessment. And so we specifically are looking at needs differently at different ages. The other thing I would say is, as with our current assessments that we use, these are updated and newer. We will obviously be doing them annually. Every year at the annual planning meeting for folks that are in the waivers. But at any time a family would feel that their needs have changed, they can make a request through their service coordinator for that assessment to be updated to see if there's additional supports that might need to be added to that service plan to meet those needs.
The other thing is, you've got one part, the front part of the puzzle solved, but how do you get the back part of the puzzle, which is having enough service providers to provide these services?
Yeah, so service provider capacity is the question. How do we go about ensuring that? That has always been an issue within health caring agencies, right? Just having enough staff in whatever environment that might be. I can tell you that we've made significant investments in our providers over the last several years, whether that's in rates, enhancements, or working directly with providers. Obviously, we had some times in the past few years where that became a significant challenge. But I can tell you the data that we're seeing now coming from the providers in their state of the workforce surveys are showing a positive trend in less vacant positions being there, and we're also seeing a reduction in the turnover, which also was plaguing some of our providers. And so we at the state continue to partner with our providers as best we can to support them in building the workforce to meet the demands of folks.
Yes, sir.
And how many of the 3,100 families that have been taken off the wait list, how many of those families are using the waiver and have entered into programs?
Let me see if I can answer that for you. So we have had, this was now not, mind you, not all of the offers that went out in the last couple weeks, But at the end of May, or when we first started June, at the beginning of June, we had the 3,100 offers that we had made. Of those at the time, 45% had accepted their services, so 1,400, and they were actually in process of getting into services. We did have 27%, or 871, who declined their offer. So as I had mentioned earlier in my speech, oftentimes people had signed up and gotten on the list, oftentimes not even really knowing what they were waiting for. And when we reached out after waiting the 6 to 8 years, the families had said, we're fine, we're still in school, things are going well. But now that I know there's not a list, I'll call you back when I need something. So we did have a group of folks that also declined their offer. And then the other bucket of folks are still in what we call a pending status, where they're trying to make a decision if they were offered 2 different waivers, which one was most appropriate. So I don't know if that helped answer, but
they're all active. They are all active.
all of them have been given an offer. So every single family off of the wait list, or that was on the wait list, or who was added, has received an offer as of today.
And then how many of the 45% who have accepted the offer can you confirm are in a youth program with that?
I may not have the specific numbers with me today on that, but so once they accept their offer, there's a process then to get into services, right? So oftentimes, if they know of a provider, that process goes much quicker. But if they're not really aware of the provider network in their various community, then they work with their service coordinator. And so we have many families who are currently out meeting with providers like Vital, doing tours and trying to pick the right provider for their loved one. And then many, once they pick their provider, they go right into services.
To give confidence, maybe to give confidence that most are getting services. How many providers do we have across the state doing services close to what Vital's doing?
Yeah, so we have right now about 170 agencies across the state. Some of them have multiple sites that they certify, so one company might have, say 5 different sites across the state. But all in all, there are about 170 agencies like Vital across the state who are there and ready to serve folks. In addition, we have a system of what's called independent providers, which those are folks who enroll directly with Medicaid. They're oftentimes family members or people known to the family. And so there's a few thousand of those providers as well across the state who are delivering care and support to a loved one as an independent provider.
The waivers, when somebody applies for them, if they qualify or they have a developmental or intellectual disability, are they automatically granted that waiver, or what's that process look like to determine whether or not somebody's waiver is accepted or not?
Yeah, so once the eligibility process, when you fill out the waiver application, that's really kind of step one to determine, one, do you have a developmental disability as defined by Nebraska statute? And then there's a secondary process called, do you meet a level of care? These waivers are all based on their Medicaid reimbursed waivers, and so you have to meet a level of care. And so in the DD world, that's generally referred to as the intermediate care facility level of care. So if your needs are at a level that would require you to live in what the feds would call an institution, then you're eligible for the waiver. From there, it really is that needs assessment that you'll work on with your service coordination team and the eligibility team that will kind of drive which waiver is the most appropriate to meet those needs. And right now on the DD side, that's the 3 waivers. We have the family support waiver, the adult day waiver, and the comprehensive waiver.
I'm sorry, I have one additional question.
Sure.
You kind of mentioned that there's like individual providers where family members are caring for their children and they can get paid through a program. If they're doing that, can they also be a part of the waiver program as well, or those services, or no, if they're getting that service?
If I understand correctly, so our independent providers are those family members or often folks known to the family. They would directly enroll as a provider, and they're a provider of the waiver services. So they actually are on the waiver and they're accessing independent providers. And so really on any of the 3 waivers, your choice is to go to a provider agency who has staff who will deliver those services and supports, or you can choose an independent provider yourself. And as a family member, then you kind of do the hiring, firing, and training of that person as opposed to the agency doing that oversight for you. Okay.
One more question, Dr. Rabba.
Governor, why did you personally take this under your, why did you want to solve this? There've been other governors that have looked at this problem before. Why did you, what made it personal to you?
Yeah, well, my why is really simple. When you roll your sleeves up and get involved with operations of agencies and you find something that's unacceptable, said, what the heck is that? Didn't even know what a registry was. So when it didn't make any sense. And I'm pretty sure it didn't make any sense to any families that are here today. So really simple why. I'm governor of everybody in the state of Nebraska. Sure as heck, our most vulnerable. And so, yeah, it was a no-brainer. It wasn't anything to think about. Just said, what do we got to do? How's this happen? Let's come up with a plan to solve it. And really proud of the people on our teams that said, hey, we can and we will. And greatest gift is belief. Once we believe, we got it solved pretty quickly. And it's making a big difference for families, and it will for generations, so it's pretty cool. All right, well, congratulations, everybody here. Thanks for being here. Big day.